afternoon, everyone. Myself, Dr. Akanksha Rangari. I am presenting my paper on pterygium surgery by conjunctival autograft with autologous blood fixation versus fibrin glue. Pterygium, it is a degenerative condition of subconjunctival tissue which proliferates as vascularized granulation tissue to invade the cornea. The prevalence varies from 0.3 to 29%. It is managed conservatively unless it is progressing toward the pupillary area. Surgical removal is the treatment of choice, but recurrence is the main problem here. Bare scleral excision alone is associated with recurrence rate of about 30 to 70%. Conjunctival autografting after excision is associated with lower recurrence rate. This study has been conducted to compare the efficacy of fibrin glue as compared to autologous blood in attaching the autograft. Materials and method. This is a retrospective comparative case series of patients with primary nasal pterygium who underwent excision from January to June 2023 in Tertiary Care Hospital of Surat. Based on the technique used to fix the graft, the groups were divided into two of 20 each patients. In group 1, the graft was fixed with autologous blood, and in group 2, it was fixed with fibrin. Surgical procedure. All the surgeries were performed under local anesthesia. Pterygium excision was done, and conjunctival autograft was taken from the superobulbar conjunctiva. In group 1, a small conjunctival blood vessel was nicked with 26 gauge needle, and blood was allowed to ooze over the bare sclera, and graft was placed over it, and then we have to wait until 10 minutes to fix the graft. In group 2, we use fibrin glue to fix the graft. All the patients were then followed up until 6 months. During each visit, we see for pain, any foreign body sensations, discomfort, or any complication, and status of the graft. These were the post-op images of patients operated with using autologous blood and fibrin glue. Results. In group 1, there were 12 males and 8 females, and group 2, there were 13 male and 7 females. The average surgical time for group 1 was 45.2 minutes, and for group 2, it was 37.5. Pain and foreign body sensations were seen in both the groups, but they were reduced within a week. Graft retraction was seen only in one case of group 1, not seen in any case of group 2. All the patients were evaluated for signs of recurrence at the end of 6 months. No recurrence has been seen in both the groups. These were the table showing post-operative evaluation from day 1 to until 6 months. Discussion. The standard treatment of pterygium excision is conjunctival autograft. However, outcome is compromised by recurrence and complications. The use of conjunctival autograft was described by Kenyon et al. In 1985. The recurrence rate has been dropped from 89 to 2%. Pan et al. In their meta-analysis, they supported the superiority of glue over suture. Autologous blood, it is a good alternative as compared to fibrin. D. et al. In the study, they have shown that 15 eyes, they shown that autologous blood is safer and comparable results to suture and glue. Conclusion. Both the techniques used to secure the conjunctival autografts were effective in reducing the recurrence rate. Fibrin glue is most effective method for fixating the graft with least surgical time and post-operative discomfort, but high cost and availability was an issue. Autologous blood, it is an effective alternative which is easily available and economical as compared to fibrin glue. Thank you. So we have seen on post-op day 1, then day 3, day 7, then on day 14, and one.
Sir's question is how many patients did you see the graft was lost?
Sir, only one patient was there with lost graft in autologous blood, not in case of fibrin glue. There was no patient in case of fibrin glue.
How did you determine the sample size?
Sir,
we have taken only 20 patients.
Yes, sir.
Is it enough for statistical analysis?
No, sir.
So you could have increased the number of patients. And did you do any randomization?
Yes, sir. We randomly divide.
Which procedure did you use for randomization?
So we give sequence to the patient, first patient for autologous blood.
That's not the scientific way. And this is already a established procedure, autologous blood with pterygium surgery.
Yes, sir.
So what's new in your paper? This study has been done several times. What's new from your study?
So it was not done in our GMC Surat.
Maybe,
That's
at
why
the
we have done
national
it.
level, anything new you want to add?
No, sir.
Okay, thank
Thank
you.
There's a spelling mistake. Conjunctival spelling is wrong. Please don't do that. You should always take care for next time. Thank you.
Yes, sir. Same. Sorry, sir.
Anyways,